Hello, everyone. Welcome back after what I hope was a restful and rejuvenating spring break. It was for me. So you already heard, if you watched the lectures that Dr. Robinson got to watch a lot of really good TV. I got to go to DC, but now I'm paying for it because I have my first cold in like 2 years. So masks work. And now that I'm wearing one less, here I am fighting an infection. So welcome back. We're going to start as usual with a little bit of time for us to get to know our two guests here this evening, and then we're going to jump into questions. And as usual, we highly encourage you to make use of the Q&A function at the bottom of the screen. We love hearing your questions. We don't always get to them just because of time, but we do love that engagement, and you being able to ask questions of these guests is a big reason why we go live in the first place, because like otherwise we could just record this and like maybe not make mistakes that make us sound like idiots for not being live, right? But we're live because we want you to benefit from interacting with our guests here tonight. We're going to end right at 7 o'clock as usual. And we're going to make this recording available on YouTube and on our Canvas page tomorrow. And you're always welcome to continue the conversation in the YouTube comments at that time. But before we introduce Dr. Robbins and Dr. Hammonds, Dr. Carol and I wanted to tell you about a really amazing opportunity that's going to be happening on our campus toward the end of this month. So as a part of the Visiting Writers series, Chimamanda Ngozi Adichie is coming to LR's campus. She is a Nigerian novelist. She wrote Americana and so many great books. And she's also the one who gave that TED Talk that Dr. McComb recommended that you watch at the very beginning of our class, The Danger of a Single Story. So if you haven't watched that yet, watch it. And then come to campus, come to see her speak on our campus. Tickets are $25 for the event. However, for our LR students, the organizers have put aside free tickets for 200 students. There are still some tickets that are available. So if you're enrolled in this class, if you're an LR student, be on the lookout for an announcement from Dr. Carol and I. We will post the coupon code that you can use to get a free ticket to come. And we want you there so badly, students, that we're going to give you extra credit for attending this event and reflecting on it. So tickets are first come, first serve. Don't miss out on this excellent opportunity. Wednesday, March 30th at 7 p.m. in PE Monroe Auditorium.
All right, great. That was great. Yes, I'm looking forward to that. Can't wait to be a part of that experience. And I want to now just go ahead and get into our talk tonight by beginning to introduce Dr. Janelle Robinson. She has been the program coordinator and assistant professor in the clinical mental health counseling program on the Columbia, South Carolina campus since August of 2019. Before joining the Lenore-Rhine family, she was an assistant professor at Alabama A&M University, a historically Black college in Huntsville, Alabama, and has taught in several clinical mental health counseling programs in Western Pennsylvania and West Virginia. She earned her PhD in counselor education and supervision from Duquesne University in Pittsburgh, Pennsylvania. Her master's in professional counseling from Carlow University, also in Pittsburgh, and her bachelor's from Tennessee State University in Nashville, a historically Black college. She is a licensed professional counselor associate in the state of South Carolina and a national certified counselor. Dr. Robinson is passionate about working with clients who are experiencing racialized trauma, as well as understanding how transgenerational trauma impacts individuals and communities of color. She has over 15 years of clinical experience counseling individuals, children, and families. Dr. Robinson is a part of the 2021 cohort of the Women's Leadership Institute at Furman University. She has conducted trainings on culturally responsive counseling and mental health during the COVID-19 pandemic. Dr. Robinson has presented at various counseling conferences in Honolulu, in Hattiesburg, in Birmingham, in Hilton Head, and Atlanta, Georgia. Along with submitting several peer-reviewed journal articles and book chapters, Dr. Robinson was the editor of Many Strides Made, African American women's contributions to African American history. Dr. Robinson thoroughly enjoys the work she does and the lives she is able to touch as a counselor, but her favorite role is wife and mother to 4-year-old Ezekiel and 1-year-old Kimberlyn. Welcome, Dr. Robinson. We can't wait to hear from you. Now, Dr. Newton, we can introduce Dr. Hammonds.
Our other very special guest for this evening. So Dr. Dominique Hammonds is an associate professor and director of the Clinical Mental Health Counseling Program in the Department of Human Development and Psychological Counseling at App State. So up the mountain. She earned her PhD in counselor education and supervision from the University of North Carolina at Charlotte, and her master's in clinical mental health counseling from the University of North Carolina at Greensboro. She's a licensed clinical mental health counselor, a clinical supervisor, national certified counselor, and a board certified telemedical health provider. So I'm sure she's had a very busy year, 2 years in the pandemic as a telehealth provider. Dr. Hammonds is president of the North Carolina Counseling Association, and she is also the recipient of the 2017 Creativity and Innovation in Counseling Award and the 2018 ACEs Supervision Award. She is passionate about increasing mental health awareness among communities of color and increasing access to quality, culturally responsive mental health care in a global society. Her scholarship and professional service activities center around a variety of subjects, including culturally responsive teaching, counseling and clinical supervision, creative teaching and supervision methods, and technology in counseling. Dr. Hammond's goals of cultural competence, inclusion, and wellness are evident in her work, both within and outside of the university setting. In addition to her work in education and research, she collaborates with community partners, engages in clinical work, and participates in community outreach. I'm exhausted just with my one job, but she's got 3. Dr. Hammonds has authored numerous scholarly publications. She has been featured by WRAL News, NPR's All Things Considered, The Shade Room, Counseling Today, and the Thoughtful Counselor podcast, in addition to giving over 70 professional, statewide, regional, national, and international presentations. I'm going to throw this out there. She mentioned that she was published in Counseling Today. What she didn't mention very humbly was that it was the cover article of Counseling Today just last year. So we are so thrilled to have Dr. Hammonds here with us this evening. So welcome to you both.
Yes, wow, that was a lot, and that's all just so great to hear. It's just so exciting just to be with you all. You know, we've talked on the playground and we talk about our kids, but now we're going to get down to some nitty-gritty information about mental health and race and racism. So Dr. Robinson, I'm going to just turn it over to you if you just have a few things you want to say before we open it up for Q&A.
Yeah, thank you guys. Thank you, Dr. Newton and Dr. Carroll, for those wonderful introductions. And I just want to say, I mean, between the 4 of us, I'm sure we can just put our biographies up there and what we've done, all the wonderful work that we've all done, and just end it right here. Because I know all of us are so in our areas of discipline. You know, we're just, I don't know, we're just so awesome, all 4 of us. So, you know, I definitely want to just thank Dr. Carroll and Dr. Newton for putting this together. And I know this takes a lot of work to get a semester-long series going on top of your faculty and all the other responsibilities that you guys do at the university. And again, thank you, Dr. Hammonds, for taking the time out to be with us. And so I'm just excited. I don't want to say much. I told Dr. Newton yesterday, you know, when I was preparing the lecture and, you know, doing the video part of it, and I was like, okay, I'm gonna leave it, you know, like 30 minutes, like I'm gonna have it there and just kind of leave it there. And so my classes are 3 hours long, like most classes are like 3 hours long in the graduate program. And my husband is like, babe, like leave it, like, you know, you teach 3 hours, no one wants to like this, keep it at the 30 minutes. I was like, I'll try. And then before I know it, when I was sending it to Dr. Carroll and Dr. Newton, it was like 50 minutes. So I really did try, but you know, it's such great stuff. It brings up such great conversations and everything I don't have the answers to. And so what I'm hoping tonight is us being able to enter this space and into a safe space, and for us to be able to be transparent, talk about our experiences, and students and community members. Thank you all for joining us. And I hope that you feel safe enough that you can ask questions. There is no such thing as a silly question or as a stupid question. Ask whatever, ask whatever your heart is, leading you to ask. And I want to add, I had a faculty member at Alabama A&M. She was an African-American woman. And she would always say this to students. She said, you know what? I'm a Black woman. That's the perspective that I speak from. If I was a purple polka dotted dinosaur, I would speak from that perspective. And I was Dr. Linda Holloway, who is now the program director, I believe, at Alabama State University in Montgomery. But I'll say the same thing. I identify as a Black woman. That is the perspective that I speak from. And those are the experiences that I bring. And I always tell my students, I say that I am a storyteller. So even in my teaching, I do talk about my own lived experiences with things, whether it's appropriate personal things and or just my clinical experiences. So I'm hoping that everybody is able to receive something from that. So I'm excited to get started. You're muted.
I was going to say, just the intro you gave us in your lecture with your collage of all the things important to you. I learned so much about you from that and really enjoyed that. So I can only imagine what your class sessions are like. Yeah. With storytelling. But I have a question, and I would like to start with this one. And it actually was prompted from something that you said in your lecture. And so in your lecture, you say that the historical racist, classist, and heterosexist undertones that they make up the counseling profession. And I just wondered, you pointed out that pioneers in the psychiatric field actually embraced racist ideologies. And so I just wonder, are you saying that these undertones that may have started way back at the introduction of the field are a mainstay in the counseling field, or have we evolved from here?
And so that's such a great question. And so first we have to understand, and I by no means claim to be a historian, but I understand how history impacts our present day and things that we've been through as a society. So I'm not going to take from Dr. McCombs and Dr. Schaefer. I know you guys did great stuff on just the history of that. But what we have to understand is racism is in the fabric of our society. Right? Our country was built on the backs of slave labor and racist ideologies and oppression. So in all disciplines, whether it's education or psychology or, people that are joining us, whatever that is a part of it. And so I think sometimes what happens is, I know we've been having a lot of conversations about like critical race theory, and you guys have put that on that homepage, and I'm sure people have varying thoughts on that. But that just brings to mind that there has to be an understanding and an acknowledgement that it is a part of all parts of our society and all of our disciplines and all of these things. And so what does that mean for our field, right? When we're thinking about assessments, yeah, is racism and race-based, like, yes, that's a part of it. When we're thinking about these theoretical frameworks, yes, that's a part of it, because when we think about our field, I don't know that communities of color were necessarily thought about, right? When we go back historically and we think about that. So if you are practicing in a field, which is really all fields, and, marginalized communities, we're not a conversation in it, yes, there's bias that's going to be in the foundation of that field. Does that mean that it doesn't go away, or does that mean that it's there forever? It depends on the people in the field, and that's why these conversations are so critical, because as counselors, and we have to be the ones to change the direction, right? We have to be the ones to change the narrative. So even though it was rooted in that just ugly racism, but moving forward, we don't have to, we can make sure that we have that level of awareness, which I definitely see that we're doing in the field of counseling. And as long as we continue to do that, we recognize that, yeah, that was the foundation, but that doesn't mean that that's where we have to go in the future.
Mm-hmm. Yeah, I was just going to say, with the increase in just culturally competent counselors, I wonder if anyone's even done the research to see if there is a change in kind of these undertones now that we're having counselors trained in cultural competence.
Yeah.
There,
And-
that's for
go
both
ahead,
of you
Dr.
all.
Hammonds, I'm
Yeah.
sorry.
Mhm.
Yeah, so I wanted to add to that. While I think that there has been an increase in training, an increase in focus on cultural competence, on culturally appropriate frameworks and techniques, I do think that the field is going to continue to represent the people in it, and it's going to be a microcosm of our society, our normative expectations, and our practices. So if we think about white supremacist ideals and expectations, that's a part of our society, therefore it's going to be a part of our field. And so that's where self-awareness and continued conversation about this can be really important. So just acknowledging where those white supremacist expectations do seep in to our work, and how do they seep in what ways can we find them sort of hidden in the, and I keep using this phrase, but normative expectations, right? We say, well, that's what we should expect.
Yeah.
What's behind the should there, right? Is there a cultural expectation? Is there a normative experience that we're casting onto how we're assessing or what we're believing is appropriate behavior? Okay, so it's understanding how all of those themes apply to our work, right? And we can't, the word that I thought of, or the phrase that I thought of was like, go to sleep. Like we can't be, we can't, you know what I mean?
Yeah.
we can't avoid these discussions, and we can't pretend that, oh, okay, we took this class and now we're
That's
good
it.
on it, right? Yeah, that's it.
Right.
Be looking for it because it will always be there.
Yeah.
Cool.
And Dr. Hammonds, I'm sorry, Dr. Carol.
No, you go.
I was going to say, Dr. Hammonds, what you made me think about when you were talking about it's a microcosm of society, that's why representation is so important. When we look at counseling on multiple levels, so when we look at counseling training, so the field of counseling is still predominantly white. That's just that, right? And then so when we're looking at counseling training programs, right? And then when we're looking at counselors, when we're looking at these theoretical frameworks, when we're looking at who's creating the frameworks, like what frameworks are we using? Who created them? When we're looking at who's creating these assessments that we're using, and so all of that. So that's why representation is so important. I know we've been talking a lot in a lot of fields, just in education, is decolonizing like our syllabus, right? And making sure that we had representation, textbooks, articles, things like that of people of varying backgrounds, but that's also so important, to make sure that we're doing that. Representation is huge. And we have to make sure we have it. And I don't know that we don't have it the way that we should right now.
There's so many follow-up questions we want to ask right now because you all have said so many things that we're like, we need to ask about race matching, but we also need to ask about just if you are trained in cultural competence, what are some ways cultural factors would influence your approach to a counseling session, or influence just a therapist's approach to the like, because we don't want to, you say, we bring our biases, right? Want those to be the influence. So then what are ways that we need to, that cultural factors need to influence the counseling?
Well, even before that, I think it struck me, Dr. Carol, and I think how you phrase it is sometimes how I feel like other people have this kind of thought. And Dr. Hammonds, you please let me know your thoughts. Sometimes it seems like when people say, okay, what area are you looking into? I want to go into multicultural counseling. It's a population, like, oh, I want to go and I want to work in, drug and alcohol, or I want to work with children, or I want to work with families. I want to work in multicultural counseling. And it's like, counseling is multicultural counseling. Like that is counseling, right? If you're not, if you're not counseling from a cultural perspective, like you're not doing, like you're doing harm. Right. And so like Dr. Hammond said, it's not just that one diversity class that you have and you took it and you learned about different populations and you're done. Like that is it. But I think that is such a misconception that people have, and maybe especially earlier in their counseling, program. But it's like, no, it's not a population. It's not like this is the population I want to work with, is a diverse population, but you have to be trained to deal with. So I just wanted to say that, because I feel like I've heard that a lot. So I know I digressed a bit, but I just wanted to point that out.
I don't think you did. I think that you added, so you triggered this thought for me. Training counselors to see what multicultural counseling is like showing a fish water. And I really like that metaphor, because it's training them to see the importance of context within every case conceptualization, in understanding who your client is and what matters and why. And so it's looking at all of the multifaceted interlocking layers and all the things that matter to them, right? And I think for many trainees, possibly prior to they get to maybe their multicultural counseling course, or, I'm teaching multicultural counseling now. And actually many of our students tend to say like, wow, these are things that I never really considered until I got to this program. So they walked throughout a significant portion of their life, not understanding truly how context matters, and being very locked into seeing things from one particular perspective, their unique perspective, right? So that's what it is. It's when you show a fish water, it's understanding that the water that they're in is not the water that everyone else is in.
Yeah, I like that.
And being able, and understanding that there are a number of unique perspectives, and all of them are important. And the unique perspective that your client is bringing, it's trying to figure out how you can value that and be able to hold space for their unique perspective while still valuing your own. Because that's where sometimes people get tripped up, is like, well, I believe this, and this doesn't fit with my unique viewpoint on life or my worldview. So like, that's not our jobs. Our job is to be able to hold space for them to explore their own worldview and perspectives.
Yeah, absolutely. I like that. I'm gonna take that, but I'm gonna credit you, Dr. Hammonds, for sure. but no, I like that, because that's what, I talked about, is that ethnocentrism, right? And just like your way and your thought process is the only way. I like that little, that picture I have, where it's a woman and she's cooking and she's like, I have the best, whatever it is she was cooking, right? And yes, I believe that. I just made a pan of lasagna on Sunday and it is delicious. These Italian restaurants, I'm right up there with you. But, it's like just understanding that there's different, and that's what we talk about is, that unconditional positive regard, right? That non-judgmental, that's what that means as clinicians, is that we don't have to agree with our client or their experiences or anything, but we accept them, judgment-free when they come into this space with us. And even if we find that we're triggered by some of their stuff and experience some of that countertransference, we need to work through that in our own personal counseling. We need to work through that in our own supervision. We need to work through that in our own time, be aware of it, but work through it in our own time.
Yeah, I know in the field of education, we teach the students like not to have a context neutral mindset, meaning you think that there's just this neutral context and, the context is the same for everyone. And it pretty much is based on your own context of seeing the different contexts that people operate in.
Yeah.
But
sorry,
go ahead,
Carol.
Go ahead.
I wanted to say, like what you're talking about, Dr. Robinson, it reminded me in one of the readings, there was a young counselor who was talking about her experiences with someone who said something very explicitly racist in the context of the therapeutic relationship. It was so fascinating to me to kind of read through how she handled that internally, and then how she handled that in the therapeutic relationship, and balancing those two things. It gave me great appreciation for the difficulty of the job that y'all do. So sorry to interrupt, Dr. Carroll. I just wanted to.
Well, I think that's a perfect segue to one of our questions from the Q&A. And this is someone who wants to know, how do I stay strong in my values as a woman of color going into the field of counseling?
I see Dr. Hammonds. I think you got something good brewing there.
It's brewing, but I want to let it sit for a second.
And okay, so while it's brewing for Dr. Hammonds, just in general, right? Congruence. So there's 3 core conditions that, when for students that have and clinicians that remember your theories class, we talk about Carl Rogers, and he, started person-centered or client-centered therapy. And there's 3 core conditions that he talks about that has to be present in order for, counseling to happen. And that's empathy, unconditional positive regard, which I just, talked about, and congruence, which is that genuineness. And so when I think about genuineness, I think about just that authenticity, right? And so that's why it's so important as a counselor, as a trainee, counselor trainee, to know who you are. Like, you do have to know who you are. You have to be comfortable with who you are. And as you're going, I don't know any counseling programs, and I don't know all of them. I've worked in a few, not every single one, but I don't know any counseling programs where someone comes out of it the same way they went in. If you come out of your counseling program the same way you went in, like, something's going on with that program, something's going on with you. You're not, like, you're gonna realize and recognize things about yourself. You do so much self-reflection. In our ethics course, students are required to go to counseling, and a lot of times students have never been to counseling before. So this is their first time going to counseling as a student in the master's program. And so just being able to talk about that genuineness, authenticity, which comes when you know who you are. So whatever your identity is, being able to be really secure in that, and not, and have a client that's not going to shake that. Right. And if you do find that it's shaken up a bit, right, examine that. Like, what is that? Like, what is that I'm feeling, where I've had this client or I've had this experience and I'm beginning to maybe question something. And that may not always be bad, but you want to be able to be authentic, but you also want to be able to be really aware of who you are, and the things that you might respond to, which you are currently responding to, and continuing to go. It's not like a stop and an end process. It's not like you graduate with your master's degree, you're good. Like, it's a journey that you will continue to be on as you're a clinician.
I think very well stated, Dr. Robinson. I think the only thing that I'll add there is just to reiterate the importance of self-awareness. So you mentioned how important it was to know who you are going into this process, and fully expecting that will grow and change over the course of your program, over your career. Not only is that expected, that's okay that we do that. And there may be some non-negotiables, some core things to your own values that you're like, yeah, I love my work. I love the values of this field, but this one thing is really important to me. That's okay too, right? I think bracketing can be a really important skill, and that's essentially having some self-awareness around what your personal experiences or thoughts are, and trying very intentionally to make sure that you are not allowing that viewpoint or value system to impact the ways in which you are interacting with your client. Right. So that's a practice, though, too. We teach our prac and internship students while they're out in the field to do that, or to at least start beginning this process. And, you may run into some clients where you have very, what's the word here? Very distinctive, maybe even visceral reactions to. Right? There's something about this one client that really rubs you the wrong way. Take note of that, right? Is there something, what is it that you're reacting or responding to? And that doesn't mean that you're a bad counselor. That means you're human, right? We all have that stuff. And so process it in clinical supervision, have a consultation group, use the resources that you have so that you can feel, as Dr. Robinson mentioned, genuine and authentic in your process. And still you, and still a professional. Sometimes, though, interestingly, those experiences where you're like, ooh, something's coming up, you may be able to even use that in your work, right? Make a self-involving statement, use an immediacy statement, something like that, right? Where you bring in your own personal experience. Now, I think there's a skill, a little bit of an art and a skill to how you might do that, because you don't want to go and let it all let it all spill out in an
Right.
unprofessional way. But how can you very carefully and intentionally, clinically use your own personal reactions in your work?
Yeah, that's really important.
Yeah, and I think kind of what we're kind of getting at is just, you know, the relationships and just building trust between clients and counselor, and just trying to determine, can there be understanding across cultural differences and racial differences. So I want to ask a very specific question, and then we're going to move to a slightly different topic. And that is, so let's use this example. Can a white counselor who has not learned about multicultural counseling effectively counsel a Black client who shares the same religious and gender identity? What challenges might occur, and how would a counselor overcome them? A shared religious identity, gender identity, but not racial.
Not saying racial. So I would really be questioning a counselor who has not learned about multicultural counseling, right? Like just in general, right? Like we talked about earlier, you know, so you should have that. And if you don't, right, you know, as counselor educators, you know, Dr. Hammonds and I talk a lot about what they're, you know, gatekeeping, right? And so even like in the field, like if, you know, if folks are, I'll just leave it at that. We talk about gatekeeping in the field. So, you know, if the counselor graduates and they're in the field, they should have learned about multicultural counseling. You know, as far as like, can someone who two different racial backgrounds, but maybe some other similarities, there has to be an understanding of the complete person. So like you said, you know, Dr. Carroll, we were talking about a little bit before, you know, if, you know, for someone, we don't know kind of like their group membership and how they rank it for them, right? So everyone is not going to have that same experience. So for some people, you know, I've heard people say, you know, I am, you know, I'm Black before I'm a woman, I'm this before I'm that. So some people kind of have their own internal ranking of like the most significant identity, you know, that they're a part of, and other people, they don't. But yeah, I mean, I think that, you know, you have to understand the complete person, you know, and if you're not understanding someone's complete identity, all of their identities, you know, it reminds me of the conversations that I think people have historically had, like, oh, I'm colorblind, I don't see color. Right. And I understand where that comes from, just wanting to, you know, not wanting to judge people. I just see you who you are, you know, how you present doesn't matter to me. But when you say a statement like that, it denies a big chunk of who somebody is. So it is completely fine to understand who someone is religiously, spiritually, like their gender, and have some of those shared experiences. But when you add that layer of race to it, that can definitely completely change up the game. Right. And then that's definitely where your experiences can differ. And so you have to be able to look at all components of who someone is. You can't just leave one out and think that there's two and like, oh, well, we can connect because there's these two we have in common. You know, you have to be able to understand like all of those components and what it means to the client.
Absolutely. I think salience and context is also really important there. I think this has been said before that the most segregated day of the week is Sunday, right? So there may be a Methodist church on one side of town and a Methodist church on the other. Very different populations may attend each service, and those two experiences are nothing alike. So you need to understand, right, the extra bit of context there in order to really see the client and how they move throughout the world. So I would say, yeah, there may be some factors that may align, but that's not enough. That's not enough. And I agree. I think I would question that too. And you said, that's all you'll say about gatekeeping. Gatekeeping, yeah, we need
Right.
That's important. That's a key factor, a key part of our role there. We want to make sure that we are sending clinicians out into the field who are not going to do harm. And so sending someone out who has not received any clinical training in quote unquote multicultural counseling, Somebody failed at their role in gatekeeping.
Right.
Mhm.
And Dr. Hammonds, even with you talking about just the most segregated hour Sunday, and that's so interesting. So I was telling before everybody came on, and I was saying that I'm new to South Carolina, and I'm from Pennsylvania, and just coming into the South. So like those regional differences, especially on Sunday, boy, it's a completely different experience. But even with gender identity, right? Gender, like someone can be, people, they can identify as female, but you can have someone who identifies as trans female, someone who, so there's even within that, there's all of these groups where, so the gender identity is going to be the same, but the experience of the person is going to be different. That's.
Okay. That's great. Thank you. And I think we're going to move to one of the Q&As. Is that I hear, Dr. Newton?
I mean, so like, we have two fantastic counselor educators who are doing excellent gatekeeping, right? So if you've ever had a counseling relationship that's been good, you can thank gatekeepers like these very competent counselor educators with us. But in addition to multicultural counseling, there's another area that we haven't quite gotten around to exploring yet, and that's the role of racism in mental health in general. So not just the counseling relationship, but mental health in general. And in your lecture, Dr. Robinson, you talk about transgenerational trauma. Trauma changes you, it changes your DNA, it makes changes for the descendants. And in the Q&A, Andrew Massey, he says, some of your comments create an interesting question. Research tells us that trauma can be passed down, epigenetics, which is something that we talked about back in week 2 with Dr. Schaefer and Dr. Esch, but also that it can be reversed by a positive experience. What are your thoughts on this? So I would want to know, can you talk a little bit more about how racialized trauma can be passed down, can be experienced, can influence genes, and then epigenetics across generations too?
I'm gonna say this. Resmaa Menakem, he is a clinician. He wrote My Grandmother's Hands. I think it is in one of the recommended books that I have for the week, and he just does awesome work. And he talks a lot about racialized trauma. And I'm gonna say this quote that he said in an interview and in his book: trauma in a person over time can look like personality. Trauma in a family over time can look like family traits, but trauma in a people can look like culture, right? And so that's so profound to me. And I'm always thinking about that, when I'm teaching and we're having these conversations about transgenerational trauma. Dr. Joy DeGruy-Larry, who I also reference, in the recommended readings, and I think I gave a video. She wrote Post-Traumatic Slave Syndrome, and she talks about trauma. And I don't want to I'm not going to attempt to quote her, but the example, and I'm saying this because to me, this lends itself to how trauma is passed down, right? And how it can take shape in people's families and communities. And so she gave the example of, let's say you have a white mother and a black mother, right? And then you have a white, and they both have children, young children with them. And the white mother says to the black woman, oh, your son is well behaved. And the black mother's response is, but he was acting up in school, and he was cutting up here, and he was cutting up there, right? Almost kind of like denigrating them, that child. And then if we kind of go back, we look at the historical context of it. Let's say, you're on the plantation and you have an enslaved black woman who has her child, and you have a slave master that comes up to her and says, man, that boy yours, he's sure picking a lot of cotton, or he's sure doing this, or he's sure doing that. Well, no, he ain't good. He's lazy. He's shiftless. He's this, he's that, right? And even how that's protection, because we know that slavery, tore apart families. Children were ripped from their mothers. And so if there's something that a mother could have did to, denigrate him in that way, just so he can stay with me, right? Now he's not, because if he's good, that means that he might be sold off, right? And so if we look at that and just kind of now 400 or 500 years later, and we see that mother and that, the two mothers, we can understand why she made that comment. right? She may not necessarily understand maybe the historical context of it, because if we go back to what Risma Minicum says, you know, what it looks like in a community, what it looks like in a family, what it looks like in an individual. And then in general, when we're thinking about just, you know, trauma on the body, right? Continuing to experience that. Again, I don't want to, Dr. Schaefer and you know, I know that you guys talked a lot about that, and I'm not a medical doctor, but what I do understand about trauma is cortisol and how it's released, and that's your fight or your flight. So what happens if it never recedes? Right? So if you have a population, a group of people that have been oppressed, right? Indigenous populations, Black folks, you know, Hispanic, like any population that has been oppressed for generations and generations, and it's like that chronic stress, that continued stress and trauma, those cortisol levels are never able to come down. Your body is not meant to maintain it at that level for so long. So then what does that do to your body? That's hypertension, right? When we look at communities of color, a common disease, hypertension, heart disease, diabetes. And we recognize that cortisol and adrenaline and all of that impacts those kinds of diseases. Your heart is beating faster. So again, over generations, like that's how that's passed down. Yeah, I'll stop right there. But
so is it possible to heal? You know, I think the question in the Q&A was, can it be reversed by positive experiences? So is it possible to heal these traumas in a way that they would not be passed down?
What do you think, Dr. Hammonds?
I don't know that I have a 100% answer to that. My mind goes to, I am a mental health counselor, so of course that is my lens. My mind goes to the importance of having space to process, making room for exploring emotions, even if it's not within a clinical situation, if it's within your family, and making space to talk about how you're feeling with the people that you care about. I see that is important, that matters, right? I also think that populations or people of color tend to, for lots of different reasons, access services less. They tend to, for lots of different reasons as well, like there's a lot of barriers to access to services, not just mental health care, right? To medical care, all of these barriers that actually keep that cycle going that Dr. Robinson was mentioning, right? So if it seems like there is, and I think there was, actually I think her name, there's another researcher who talked about the impact of oppression, and she likened it to a system of gears. And so you may have interlocking gears, but you can change one gear or slow it down or create some kind of resistance in that one. But because all the gears are interacting, the machine is going to keep moving. So I think there's a deck stacked so high that even small changes, making small changes, it's still going to take a significant amount of work to slow down that machine, to stop it, to undo what's already been done. Now, I don't mean to sound hopeless in that process, and that is not the goal. I think the message that I do want to send is that I think we all have a responsibility to, within our spheres of influence, be working against the gear, right? Searching for, where are these impacts? What can I do? Yeah. Mm-hmm.
And that's that macro level, right? And so kind of the macro and then the micro level, right? So when we're looking at that macro level, that's, you know, what Dr. Hammonds is talking about. I mean, there are societal things, there's structural things that have been put in place for hundreds of years, you know, against minority populations of oppression, right? And so that is going to directly impact, you know, how somebody feels about themselves. And we're talking about like, can it be undone, or can we kind of stop that from continuing to happen? it's so kind of it's like a multi-jointed thing, right? So on an individual level, right, there are things that you can do. That's when advocacy comes in. That's when social justice comes in, but we also have to, I don't want to just reiterate what Dr. Hammond said, but she said it so wonderfully, like just on that macro level, like the change has to also happen there. So if the change is not happening in these larger systems and these institutions and these structures, we are going to keep doing the same thing. And unfortunately, I think in some of the ways that conversations have been going in our society, it seems like there's almost from some people a desire to reverse things, right? And to not, have so many conversations about that, which I think is just so unfortunate.
Yes, I completely agree. And I think often at the systemic level, and granted, I am not a policymaker, I'm not in government at all, but just as an observer, it seems as though sometimes if there were to be a large systemic shift, in order to do that, there also needs to come with an acknowledgement that what has been or is, or even historically happening, that there was a wrong somewhere down the line. And so that can be tricky. I know there's been lots of discussion about, well, how do we undo this? How do we fix this? But then the other question that tends to follow those discussions is, well, where does the fault lie and who takes responsibility for that? And if now we see that there is a problem to fix, how does that problem get fixed? And sometimes it boils down to finances. So who pays for fixing the problem? That just unpacks and opens a whole other box of worms. Is that a phrase? Box of worms? It is today. Okay.
You made it one, so there we go.
So there's an avoidance is what I'm trying to get to. There's often a let's put a band-aid on this thing instead of really trying to disrupt the system that is in place, because disrupting the system is going to be like goodness, pulling the center string in a ball of yarn. And like that's going to be very impactful, and we don't know how to put it back together.
Well, I want to create a little dissonance here. Macro level gets so much attention, and that's important. Policy structures, like I recognize that importance, but I'm reminded from an earlier class today, there was discussion of just Frederick Douglass and how, when he learned how to read and realized he could read, he realized he could do the same things that his white oppressors could do. And it changed how he saw himself. And from that day forward, he was different. His thinking was different, and it impacted his actions. And we know that, he went on to do great things. So when looking at issues of just positive identity development, might micro level forms of racism, particularly the emphasis on internalized racism and the role of family socialization and cultural values, be more significant and pressing to deal with?
I think so I feel like you're going to feel that first, but I think the things that you feel on the micro level are directly related to the macro level, right? I think if we're looking at, so it makes me think of, we talk about like beauty standards in a lot of different communities. I don't know if anybody remembers Easter Sunday and you sit down and you got to get your hair pressed, and my mom would take the hot comb on the stove, and I still smell it sizzling and burning my ear.
I got some burn marks.
Right? Like I remember seeing fade cream, so it's like, I think when, you're thinking about that micro level and just how you feel about yourself, that is so directly impacted by what's going on in society. Because if there's no representation, and if the representation that is out there is demeaning to certain populations, right? Like then that will directly impact how you feel about yourself. And so I think that there are some people, and this to me is a more of a familial and community type of thing, right? Again, going to that representation, if you're able to bombard when people are children, you know, with images of people that look like them, whatever community that you're in, right? So it's not a thing that I'll share. So my son was in the hospital when he was like 2 years old. He had to be admitted to the hospital. He was like 1 or 2. And so before he was discharged, it was like a discharge nurse. And she said, well, you know, Ms. Robinson, I need you. And we had just moved to South Carolina. So I hadn't yet found a pediatrician. She said, before your discharge, I need to know that you have an appointment on the books with his pediatrician, you know, to follow up whenever he's discharged. And so she gave me a list of pediatricians in Columbia. And I asked her, well, are any of the pediatricians on her Black? And she's like, well, why is that important? No. And I was like, because I am Black and my son is Black, right? And representation is important. So I want him to see that you can be a doctor. And I know that because I had a Black pediatrician, you know, my doctor, or you can be a dentist, you know, so that representation is so important. And again, to me, I can't not connect that to things that are going on in the meso and the macro system, because it's representation in training programs, you know, professors, things like that.
Yes, I would argue that there would not be, and maybe this is a strong statement that I'm about to make, so I'm a little nervous, but I would argue that there would not be internalized racism without white supremacy. So how could we say that it is more important to focus on the internalized individual acts rather than the system that supports it, that creates the need for it, right? That upholds those standards. So if there is white supremacy culture, and we're using the example of beauty standards, we all know, we could think of so many examples of how that permeates our society, right? Colorism is one example. We talked about the hot comb, so straightening your hair when you want to look quote unquote presentable, AKA white, right? Or white passing. That's what that really means. So if there were no standard, and I go like this, but if there were no white standard to compare to, there wouldn't be internalized racism. That's where my mind is going.
So I'm just thinking about, you have a client that comes in to see you and they're dealing with some internalized issues, the things that you all maybe, you know, issues of colorism or just how they see themselves. Obviously, what's your approach to that? Because I mean, you have to deal with what they're doing there. And so, yeah, I guess from a counselor's perspective, is that the most significant in a counseling session, I guess?
Well, in a counseling session, I would say we would be only focusing on the people in the room. So the person who has the most ability to change either the situation or how they view the situation will be the client, right? And those are the options that we would present them. Like, okay, so we can process and kind of talk about how you see this, or you can change the situation. Those are your only 2 choices. Actually, no, there's 3. There's another, reality therapy also suggests either you change your view, change the situation, or just accept that things are going to be this way. So of those 3 things, what are you going to do here? And most of the time people are going to say, well, I'm here, so let's process through it. Maybe I'll change the way I see it. Or maybe you could help the client advocate and change the situation. So it could be a number of different things, but to, I think, more specifically answer your question, cultural identity development would be my first thought, is let's process through that internalized, your experiences. Internalized oppression may be one of those things, but when did you first realize your cultural identity? What was the experience of dissonance that maybe popped you into this place where now you're looking at your culture or things about yourself and then judging them against whatever standard this is? So we'll process through the phases of this model and think about what the client wants to do with that. Sometimes the process is enough. Our role is not necessarily to push them through the phases until they get to typically the last stage or phase of, and a cultural identity development model would be like acceptance or internalize, internalized acceptance, something similar to that. Maybe they're not going to get to that. Maybe it's, I need to figure out where I am at this point, and that's enough for our work together. So I don't know. I think I gave a lot of information there. So I'll stop
That
talking.
was great. No, that was great. Yeah, thank you. Thank you.
It was great. And your whole approach, it makes me think of this question that has come up in the Q&A. So Jada Carter, she's thinking about the whole person, right? So Dr. Price before spring break, she was an expert in public health, and she was talking about barriers that are rooted in racism. And Jada wants to know, is the mental health field working collaboratively with other fields? So she's in public health, and many states are moving toward a health in all policies kind of an approach, that holistic, whole person kind of an approach. Is that something that's happening here? Do y'all have any word on that kind of public health whole person approach?
Absolutely. I mean, so collaboration is a big part of what we do. So kind of two parts. Collaboration is a big thing that we're doing. So whether it's collaborating with, other professionals that have other areas of expertise in the field of counseling, whether it's collaborating with the educator, or the psychologist, or, whatever field, the social worker. So collaboration is so huge in what we have to do. And public health is a part of that too. And more specifically, public health issues can become mental health issues. They're not disconnected. They're very much connected, so it's critical for a mental health clinician to understand what is going on. I mean, we talked a lot about with COVID-19. If that's not the biggest public health Mary's mental health thing that we've seen recently, I don't know what is, right? Even when, who's getting sick, right? Initially, communities of color, because they already have, other health ailments, there's already health disparities, access to hospitals. So now we're talking about people in rural communities, people who have migrated here, and maybe they are fearful of going to the hospital. So they're sick, but they don't want to because it might question their migration status. I mean, people who English is not their first language, right? And not wanting to go because of the discrimination. So that is a public health, and then dealing with that, right? So now you're dealing with the fact that you're home, you're sick, you can't provide for your family, because you're not able to go to work or whatever. So to me, you can't talk about one without talking about another. I mean, it really is such a marriage when we're thinking about public health and mental health.
I completely agree. I do wish that there were more integrated care settings, though. It seems like we're kind of in our silos. And so you either choose to focus on one over here. But I would love to see more of those integrated care facilities.
What would that look like, Dr. Hammonds?
I don't know. I'd love to see a facility where you could go and get mental health care, nutrition services, or nutrition counseling. You could go to an exercise class. You could, a number of different wellness focused, health focused activities in one space. And that would be maybe our template for community mental health, rather than, these little pockets that we see. That would be a dream.
Yeah.
It makes me wonder if, sorry, Dr. Robinson, please.
Sorry, Dr. Newton. And I was going to say, and then everybody doesn't have that access, right? So then we're talking about equity. Everyone is not, so then even when you have to do it like that, the way it is, Dr. Hammonds is, so now I have to take a day off of work possibly to go to see my therapist. Then I need to take a day off to deal with the public health. Then I need to take, so everybody is not able. So then that's not, right? That's not equity. Let's not talk about, my husband is an assistant principal in a rural part of South Carolina. Let's not talk about So are there places where they can go in these rural communities? And if they have transportation, how can they get there? So that would be such a dream, to be able to go somewhere and to get all those services, because everyone doesn't have the luxury to be able to access and take off and transport themselves to all of these different specialists and therapists and people that can help them.
Mhm.
I like that. Dr. Robinson, you made you think about access. It made me think about stigma and a reduction of stigma for mental health care. If it was a kind of one-stop shop kind of thing, it might make it more acceptable culturally.
Yeah.
Well, we have so many more questions, but it is 7 o'clock. But I will just end kind of with this quotation from your lecture, Dr. Robinson, that one of the people who are on with us today, Shirley Brockenborough, wanted to just share that she thought it was just an excellent quote from Maya Angelou. History, despite its wrenching pain, cannot be unlived, but if faced with courage, need not be lived again. And I think that's just something for us to reflect on as we move on and depart from here. So I just like to first thank you, and thank you, Dr. Hammonds, for this is great. We need more time. Thank all of you who are online with us, and just remember that recordings of tonight's discussion will be posted on Canvas and YouTube. And next week, come back at 6 o'clock. We will be joined by Dr. Shaheen Tasharafi, who will discuss the influence of race on the criminal justice system process and outcomes. It's going to be good. Thank you all.
Bye, everyone. Thank you.
Bye.